Hello everyone, today we're going to talk about breast surgery. Have any of your relatives or friends suffered from breast cancer? Does it bother you that your breasts are too small and inappropriate? Well, all this or more can be treated by breast surgery. Breast surgery is a procedure that modifies a woman's or man's breast. Such surgery are done for a variety of reasons. In this video, we'll explain to you everything related to breast surgery, what it is, the reasons for resorting to it, and the possible complications of the operation. Our role today is to answer most of the questions regarding breast surgery. Today we have Dr. Rhee, who is a leading doctor at Grand Plastic Surgery. He's going to discuss with us everything about breast surgery from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. So here comes to our breast augmentation questions.
Yes.
Do clients have to replace their implantation after sometimes?
This is a very common question. Many ask if they need to replace them every 10 years. The manufacturers say in about 10 years, about 10% actually change them. That implies that for 90% of patients, there's no need to change them. They add that after 3 years. An MRI checkup is advised every 2 years. If there is no rupture or issues when the checkup is done, there's no need to change them. If there are no issues, one can continue to use them.
So what should clients do when the implants accidentally break open?
When there is damage to the implants, usually the patients do not usually feel it. The contents are insulated within another layer and do not leak. Some feel it faintly, describing the condition as if their breasts feel slightly softer. The reason why an MRI or ultrasound is recommended every 2 years is in order to check whether there is damage to the implants. If self-diagnosis is possible, it is often when the damage has been done long ago, about 6 months to a year. Most will feel the breasts getting softer, but there are cases when the results are the opposite, whereby the breasts get harder due to exposure to the leakage. So if after 4 or 5 years, the breasts suddenly feel softer or too hard, it is recommended to do an MRI or ultrasound checkup.
So is it possible to have breast lumps or mastopathy after breast surgery?
They don't occur due to surgery. The implants go underneath the muscle layer, and lumps occur in the mammary tissue. So they are separate and not related.
So what are the points to pay attention after breast surgeries?
There's no special thing to worry about. You can live life normally. However, while there are many women who like to exercise, it is best to do sports that do not involve excessive muscle use of the breasts, such as push-ups, bench presses. Such activities increase muscle mass and can increase pressure to move the implant somewhat. Even in Pilates, there are movements that involve pushing one's arms forward. It is best not to partake in such movements. It is best to watch out for slippage of the implants. Focusing on stretching can be good. Aside from those, about 3 months after surgery, one can do normal daily activities.
네, 알겠습니다. 네. Today we learned many things about breast surgery, and the doctor explained in details everything related to this cosmetic procedure. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.